Treatment of angle class 1 malocclusions. The theme of this lecture is that if you're inclined to pursue orthodontic treatment in your practice, whether it's with aligners or fixed appliances, start with class 1 malocclusions. You might want to save the more difficult class 2 and class 3 skeletal discrepancies for another time as you gain experience. Full treatment appliance systems included labiolingual, Johnson twin arch, beg, lingual, and eventually ending up with the edgewise appliance. Edgewise appliance was invented, if you will, with a series of modifications from Dr. Angle. The edgewise appliance allowed three-dimensional control, but did require arch wire bends, and with it you could obtain bodily movement. So with a pure edgewise appliance, the slot is cut vertically in the bracket with no other angulations, and if you filled up the bracket with a large rectangular wire, the teeth would line up in a linear fashion, like fence posts, if you will. The refinement of edgewise was the straight wire pre-adjusted appliance that came to be in the 60s. With it, you had enhanced three-dimensional control. You were building treatment into the appliance, and the aim was to minimize wire bending. You can never eliminate wire bending, however. So you see on the diagram on the right, compared to the straight slot, now there were angles cut into the bracket that would promote and provide the roots lining up in the position they were supposed to line up. In the pre-adjusted edgewise appliance, you would start with round wires, smaller round wires, progress to larger round wires, and eventually fill the slot with the appropriate rectangular arch wire. This is what a lingual edgewise appliance looks like. Was followed, or about the same time, ceramic edgewise was introduced. And again, the overall concept, you have a wire that you're attaching into the bracket. That is, you're loading the arch wire. You're creating a loading force, and as the arch wire returns to its original position, that is an unloading force. With the newer alloys, we can engage arch wires into some fairly significant deviations. Arch wires will level curves of Spey and Wilson. There are charts that are available to show ideal bracket placement. Generally, though, the brackets are placed at the midway position in height of the teeth. If you have a fractured tooth, you have to visualize where the original midline would be. Treatment of angle class 1 malocclusions. Along with the angle classification, there's a Dewey-Anderson classification. Note that in a class 1 malocclusion, actually this is 60 to 65% of the U.S. Caucasian population. Class 2 is less, maybe 25 to 30%, and class 3's much less than that, less than 5% of the population. In the Dewey-Anderson classification, we have class 1, type 0, that shows no abnormalities. Class 1, type 1, we're talking about crowding. Type 2, protrusion or spacing. Class 1, type 3, describe anterior crossbites. Type 4, posterior crossbites. In class 1, type 5, we have loss of teeth with drifting. So let's start with class 1, type 1. Non-bicuspid extraction scenarios, we have less than 3 millimeters of crowding. We consider interproximal reduction or reproximation or stripping to reduce the width of the teeth and promote alignment. Again, in treating orthodontic patients, look for hyperactive mentalis and lingual tipping. We don't want to treat these. We have to eliminate the habit first because we'll align the malocclusion, and if the habit is present, the malocclusion will return. In a first bicuspid extraction case, we have more crowding. Again, class 1 molars and canines are present, and we don't want to do this with other skeletal discrepancies present. We don't want skeletal open bites, for example. And a convex profile would benefit from some profile reduction in a first bicuspid extraction case. So to summarize, you have moderate to severe crowding and/or protrusive profiles. In a second bicuspid extraction case, again, class 1, type 1, you have less crowding. The profile is flatter